Well, welcome everyone to our Board of Health meeting today, November 20th, 2025. I'm going to start the meeting with a call of our roll. I will start with Morgan Shields,
Here.
Nebu Kolancherry,
Here.
Melissa Teppi,
I'm here. There we go. Found the buttons.
Liz Wright,
Here.
and I realize, I'm sorry, Liz, I probably should update your name in the role.
You're good. I am also updating my name in many places.
Um, Barbara Luty, Dr. Luty here. All right. Enbal Shakam, Deidre Griffith,
Here.
Colleen McNicholas, Christopher Daly,
Here.
Brittany Jones,
Here.
and Kristen Simpson.
Here.
All right. Wonderful. Well, thank you all. We have a pretty packed meeting today with some pretty important topics. We're going to approve the Zoom from the October 16th meeting as our minutes next. Then we'll go through committees with some updates. And then we'll hear from the Department of Health staff on some important topics, especially as we're heading into winter. And then we'll talk a little bit about our follow-up with Mayor Spencer. The first order of business for the board is that I will entertain a motion to approve the October 16th, 2025 Zoom video as our meeting minutes. Is there a motion?
So move.
Hey, April, can we vote in the agenda?
I'm sorry?
Can we vote in the agenda?
I would need someone to um, offer some insight into uh, how that is done. Is there someone who can
Just call
offer
for a
some?
motion.
Mhm.
So I can call for the motion to approve the agenda for today.
Does that involve having a discussion on it?
If I don't, maybe I don't know how other board members feel about it.
Chris, I
People.
am on a few boards. I have never approved an agenda in my recollection, but I'd love to learn more.
I haven't either. The boards I'm on, we typically don't approve the agenda at the meeting.
Yeah, I agree. Usually it's approving the minutes from last time and then we move forward.
Um, can I make a recommendation um, that the governance committee take this topic up in the next meeting and come back to the board with either a recommendation or some sort of process that we think the board should follow.
That
Does
work?
that make sense? Okay.
Yep.
Sounds good.
All right. All right. Back to approving our October 16th Zoom video as minutes. I believe I heard a motion, but I'm not sure from who.
You did. It was Deidre. It was me.
Okay. Thank you.
I second.
Okay. All right. All in favor of approving the October 16th Zoom video as our meeting minutes, please say aye.
Aye.
Is anyone opposed? Please say nay. Any abstentions? Hearing none, the motion passes. We are officially noting that the Zoom video from the October meeting will be serving as meeting minutes. Okay, I'm going to turn it over to Kristen so we can kick off updates regarding our committees. Kristen?
Thank you, April. Good morning, everyone. So happy to see so many faces. So I will start off by just having committee updates. I know that Dr. Shatcham is not here today, and so if there's a representative from the Academic Partnership Committee that's prepared to speak on the behalf of the committee, that would be much appreciated. We'll get started by doing a quick update on the community engagement meeting. This portion of the agenda is just so that we can all hear the work that we're doing outside of board meetings. And I have a small announcement. I guess I'll do it now. I know we talked about having some sort of task force so that, we can do some um, crosswork. That's not the word I was looking for, but that's what came out. So we're gonna go with it. Around what other committee members are doing and how we can like explore topics a little more deeply and having deeper discussion. So not to take up so much time on board meetings, but also want to ensure that everybody's voice, opinions, concerns have a space to be uplifted. And so with that being said, we did a sort of a poll a couple of months ago where I sent a link and you all had told me where your availability was, and it looked like Tuesday afternoons work best for most people. And I apologize, I don't have my notes in front of me at the moment, but I do believe, if my memory serves me correctly, I have chosen a tentative date to present to you all, which would be January 13th from, I believe, 1 till 2:30. Is that what I said? I will confirm.
I think
in
that's what we talked about.
Okay. So kind of put that on your calendars or explore your calendars. I know that that time didn't work for everyone. My idea would be that there'll be some sort of tangible resource following the meetings, whether it's just meeting notes and or a recording so that if you missed it, you can kind of catch up on your own time. We can discuss that as a group, what people feel most comfortable with. I can commit to at least having some notes, some shorthand notes for you to review. If anybody has any questions about that, please feel free to email me anytime. But currently, tentatively, January 13th in the afternoon, believing starting at 1 o'clock, will be our first kind of joint committee meeting. And then we were planning to have them quarterly. So following that, we can go ahead and do community updates. I will start. Thank you, Liz. I will start with our community engagement committee. We did meet. We usually meet monthly, the first Thursday of every month. We met on November 6th. We had the pleasure of having Shantae join us during this meeting, and that is a consistent support that we appreciate so that there could be synergy between, board members and what's happening boots on the ground with the department. So I'll give some brief updates, and I may call on a few committee members to kind of expand on some areas that I feel like they are more closely working alongside. So we talked about Affinia had some good updates happening in their area. They're going to be launching a new residency program, which I think is really cool. We talked about us entering into viral season and how flu and RSV vaccines have been available and that distribution has been going well. We also talked about how COVID vaccines have been remaining a challenge in terms of availability to order, supply shortages, and government distribution issues that poses a challenge to getting those to community members. There's some future supports around getting staff kind of prepared for Medicaid enrollment for uninsured and underinsured community members in this season. We also spent some time talking about unhoused and emergency weather response. Dr. Ludi, who is not present today, that does a lot of outreach work for the unhoused community, just described how she continues to support individuals during the cold weather response. Last year, in partnership with the Department of Health, we were able to distribute several at-home COVID tests, which they usually only last for about a year, so they expired around this summer. And so we're just trying to think of more opportunities to get, at-home tests during viral seasons to people that maybe don't have homes. And then Dr. Ludi also brought up some discussion around the Gateway South project and wanting to understand more context around how that can impact or yeah, how that impacts the community. So we are exploring that topic a little more closely. We talked a little bit about SNAP and WIC and food assistance. I may take a pause just because I do want to uplift the work that our board member Brittany Jones has been doing, and I may just have her putting you on the spot here. But if you wanted to do a quick, brief overview of the work you've been doing and how you've been kind of doing this regional response for our communities.
Sure. Thank you, Kristen. Good morning, everyone. Essentially, what's been happening, since I'm sure everyone is aware at this point, due to the government shutdown, there has been a pause in benefits starting at the month of November. And so prior to that, November 1st, IHN started convening and coordinating our local food landscape partners. So that it consists of our food banks, our food pantries, our kitchens, farmers, food trucks, and making sure that they are receiving the support that they need. So they mainly needed monetary and resource support to meet the increased demand, to be sure that folks have access to food. So that's been going for the past couple of weeks now. Still trying to obtain more funding and resource to best support our members, but they're doing the best that they can, and they're doing an amazing job in trying to making sure folks have food as well as other supplemental resources that they need to be well and healthy and survive this crisis. So thank you all there's many on the call here who have been in support of the movement that we've been doing and wonderful partners in that. So I appreciate that. And I really believe that the task force will be instrumental in coming together, especially during crises like this as we foresee this. So we'll continue to come. So thank you.
Thank you so much, Brittany, and for spearheading such a large project across so many different municipalities. So to that, I think where we kind of stood is I know that there are some department staff that have attended those meetings. A lot of nonprofit have been on those meetings. I think well over 100 people at times have been on those meetings. So I think the charge here is really just share what you know, as soon as you can, as quick as you can, social media with organizations. I am confident that many of you are already doing that, but can't do that enough. So for the moment being, continue to share. If you have any questions, can reach out to myself and or just Brittany. If you're interested, if you're not on those meetings and want to be a part of them, you can let her know. We also talked about the Radiation Exposure Compensation Act. And I know that we're in city, and I know that that's a county initiative. However, the eligibility requirements are people that either have worked in the county, lived in the county, or went to school in the county. And so those could also be city residents. And so we discussed how there is opportunity for us to collaborate and have some resources. Potentially, I can continue to explore that with Shantae, but having some trail of information on the city's website of how to apply, maybe in even partnering with some of the county's efforts in terms of them establishing a vetted community hub that is actually helping people apply. I know they have submitted over 800 applications right now. The first round of people have already received their claims. Claims are from $25,000 to $50,000, depending on if you have directly been affected or if you are a descendant of somebody who has now passed away. So if you're interested in more information on that, I've been a part of some conversations. I have some packets that I can share with board members, but I do think that is a conversation we should be having with folks. I think the year is 1949 if you have been in the city in these certain zip code, or I'm sorry, the county. And actually there's a few city zip codes because I actually am from the city, and my zip code I grew up in is part of that. If you know of anyone that has worked, went to school, or resided in the county at any time, or some of those city zip codes, they should explore if they qualify, and I can connect them to a nonprofit that's working on supporting people through that. What else did we discuss? Not to take up too much time. Sorry, we had a good meeting, y'all. And we have also talked about, I'm going to reserve the updates from the Department of Health because there's a specific part on the agenda today where those updates will be given. And so I will skip that for now. And Shantae and Commissioner Anwari will talk about those things later. And then I am going to put another board member on the spot. Dr. Daly, if you wanted to talk about the initiative around free education for community members, you have the floor.
Yeah, definitely. So over the past month, I think about a few months, I've been working with the Department of Health on awareness about MSK pain management, wellness, and nutrition. So the department is bringing a nutrition piece, and then I'm coming in with the MSK pain management and wellness talk. So we've been in the community for the last week, or we have our last talk today, actually. It's been going really, really well. Love being with the residents. They have a lot of big personalities and they're very fun to work with. And they really enjoy the feedback that we give them and the practical tips and habits that we give them. And these places are experiencing a lot of chronic pain. So we pulled the data and saw specific zip codes that experienced the most pain, and we targeted those areas, and it's been really well. So really enjoying it. And I know Shantae may want to speak on going forward on how we as board members may interact with the department when it comes to collaborations. I see a hand up. Is that for this?
Potentially. Tyrell, did you have something you wanted to share?
Sorry, that was actually an accident. I'm sorry.
Okay. But yeah, other than that, that's what we're doing. And yeah, so you might have any questions, or Shantae, you have the floor if you want to speak on.
I will keep it brief. I think that in our next community outreach meeting, I'll be happy to walk through the ins and out of partnering out in the community with team members, because there are certain things that we have to be mindful of when we're community facing. Thank you.
Thank you, Shantae. And with that, that kind of concludes our community engagement committee update. Now that we have the board share drive, those notes have been uploaded there if you wanted to review some of those more deeply. And then I will pass it over to the next committee, which is academic partnership. Do we have someone from that committee that can share an update?
I was gonna see if Morgan wanted to share, since Dr. Shockham is not here.
Yeah, sorry, I'm driving. I actually have not been able to make the past couple of meetings because it conflicts with a mandatory class that I have to attend. So I'm not the best person to give an update. The only thing I can share is we're still waiting to see if our PCORI grant will be invited for a full proposal. But that's all that I can share.
Yeah, and with the academic partnership meeting, we canceled the last one. It was supposed to be this week. However, another update that we can possibly share is that we did create a drive for our materials, because I know we're working on potential internships with the different number of universities across the area. So we created like a place to put the documents, like a centralized place. And I think our next meeting will be next month.
Okay, thank you both so much for sharing what you know. And any additional updates that we may learn from Dr. Shockham, we can put in the drive and share with you all in the future. If there are no additional questions for the academic partnership portion, I will turn it over to governance. And April, you have the floor.
Thank you very much. As we talked about in our meeting last month, the governance team has been focused on bylaws for the past several months. And part of why we've been focused on bylaws is, one, because we do need to be looking at our bylaws every couple of years, which hadn't happened in a while. So they were overdue. And we also wanted to make sure that we were looking at them with a lens to make sure that we were honoring the requirements of Ordinance 71994. So every board needs to have a set of rules. And so we took the past several months to look at the bylaws to make sure that we were offering clarity to members of the board about what our roles and our duties are and how our board functions. because, well, I joined the board in April of 2024. And there were some questions, or have been questions about the kind of functioning of this board. So we wanted to offer some clarity. So last month we held some sessions after the October 16th meeting where members of the board could come and kind of have a feedback session and offer your thoughts and insights on elements of the bylaws. So we took everyone's feedback in. I know, and thank you too for all the folks who weren't able to join but still sent emails so that your feedback and your comments could be shared. And what we have, and if you don't mind, I have sharing capabilities, I believe. So what was sent to this committee is the document that I am sharing right now. So what we asked folks to do after the feedback sessions were done, governance took a look at all that feedback, refined it down to what you see in the document that was sent out to everyone on Monday as final. And again, the revisions were focused on achieving clarity on the purpose, process, membership, roles, and duties, altering some old and gendered language that didn't add to the meaning, and then, of course, ensuring that we are meeting the needs of the city in terms of Ordinance 71994. So the motion on the table that governance is offering to this board is to approve the revised bylaws, including Appendix A as presented. If the motion passes, the revised bylaws will take effect immediately. If the motion does not pass, then the existing bylaws will remain in effect. So for folks who were not able to offer feedback or didn't offer feedback on the bylaws, I hope that you have taken the time to do a thorough look at what is offered here, but I will highlight a couple of areas that have a lot more clarity than they did in previous versions of the bylaws. The most recent version was approved in 2017. Our purpose is essentially the same. We have the same kind of officers. There is some clarity around officer terms. So while we have always had 2-year terms, in this version, elections happen in the month of December and terms start in January. So versus they were kind of happening at different points in the year, it seemed. So there's a little more clarity around that and what that process looks like. That does mean that if these bylaws are approved today, then we will have an election at next month's meeting, to be clear. Another section that I wanted to make sure folks were clear on is that in the members section in section 3, we offered more clarity around what our duties as a member of this board are. So you'll see in numbers 1 through 5, those are hopefully more clear than they have been in the past. I think these have always been duties, but I don't think they were really named in this way. And so that offers some additional clarity. Also in this section, there is a section around vacancies and removals. Of course, there's always been a process for folks to leave the board. The mayor does have both the power to appoint and to take folks off the board. We also added in Appendix A, some clarity around what exactly does the board think some possible causes or reasons might be for the mayor to actually take someone off the board. Wanted to make sure that although it is not within the board's power to do so, that either if the mayor chooses to take someone off the board, that we have some thinking around wanting to know the reason, and there's a list, or if there's a member of the board that is acting out of the scope or purpose of the board, that we understand what that means. And basically that we're not just kind of recommending people are taken off the board for reasons that don't have anything to do with their actual duty or function on this board. Also added clarity to committees and how committees work. Chair terms are 1 year. They will likely, although not totally stated here, but likely run the same or similar terms in terms of start of the year as the chair and the vice chair, and they will meet quarterly. So we're adding a little more structure to make sure that committees are meeting on a regular basis. And we can certainly talk with chairs about how to make that easy for folks to schedule, but want to make sure that we are actually doing the duties of the board. And so committee work is where much of that is taking place. And specific to governance, there's a couple things that were added. One is this number 4, reviewing nominations to the board in partnership with the mayor. That has sort of been a practice at times, but not always. And so now it is stated. And also coordinating board member orientation and training, which will very likely be one of the topics at the next governance committee meeting, along with nominations, because we want to make sure that as folks join the board, that they have a good sense of what is happening, what is going on, and how they can offer, how they can serve as they're serving. The meetings section hasn't changed. Conduct of the meetings really hasn't changed. It does offer, as the last version did, clarity for how motions are called. And then the safekeeping of the rules. Before was noted that there would be a physical copy to be stored. And as we now have our Google Drive, we will make sure that these are saved in our Google Drive. Department of Health staff maintain that drive. And these are going to be a public document, which means that they will be published on a city website once they are officially approved by this board. Or if they're not, the existing version of the bylaws from 2017 will be the ones that will be posted. So I'm going to stop my share. So what I would like to do is call for a motion. Then we'll have a second, discuss the motion, and then we will call this matter to a vote. Does that work for the members of the board? Okay. As a reminder, the motion is approve the revised bylaws, including, I'm sorry, let me go back 1 second. I'm sorry. I realize I did not actually share Appendix A on the screen. Sorry, I'm going to scroll down. Appendix A was mentioned, but I didn't show it. So when we talk about Appendix A and potential causes for removal, this is potential causes because, again, as members of this board, we don't have that power, but this is to ensure that everyone understands what their role and duties are as members of the board. And if not, the board does have the power to make a recommendation to the mayor. So part 1 is centered around operating outside of your scope. And folks have a copy of this, but wanted to make sure that we cover this in the meeting. Covers things like, overstepping, speaking as a member of the board in a role that really doesn't make sense, or you don't really have the power. Conflict of interest, etc. The next cause would be a group of topics that we've called non-functioning, and that would really be around, are you attending? Are you participating? Are you ready for the meetings? And please note that in the section on membership, the duties of a member of the board are noted. So this is not just to say that we're focusing on the negative, but we did want to add clarity to some things that had not had clarity in the past. So hopefully that is all very clear to folks. All right, I will now stop sharing. I'll go back to reading the motion, and then someone can make the motion. Okay, approve the revised bylaws, including Appendix A as presented. If the motion passes, the revised bylaws will take effect immediately. If the motion does not pass, the existing bylaws will remain in effect. All right. That's the motion on the floor.
Second.
I'm sorry, who seconded?
I did, Colleen.
Oh, okay, thank you. All right, so now we will entertain any discussion of bylaws. If there is none, then we will go straight into a vote. So I will open the floor.
April, I have a question, and Deidre.
Yes.
Newly on the board, those, so I don't have context for how everything played out historically, but those look like very sound and reasonable revisions that make a lot of sense. The only question I had is about you said we'll end up voting this December or doing an election this December. And I don't know if I feel like I understand how that impacts current board members or opening up to new board members' schedules. I mean, how that may impact current board member schedules or not. Maybe it doesn't. I just don't feel like I fully understand that part.
In terms of the
new
duties of new chair or vice chair?
The new schedule. You said folks would come in pretty much at any time of the year previously, but now, unless I misinterpreted that, but now it's formally a vote in December and formally coming in January.
In terms of starting in those officer roles.
The officer roles.
Yes. So
okay.
The people that will be named to those roles. So my current term started in April of 2024. So a 2-year term for me would normally end the end of March 2026. So this essentially would shorten my term. And then the board would have a chance next month to start on this new schedule of voting for a chair and a vice chair. So in terms of the schedule or the kind of timing, it cuts my term short by a few months. But to me, it doesn't feel very significant because I have been in this role for almost 2 years.
Okay. That was exactly my question, and you have clarified it. So, thank you.
Sure. Are there any other questions or points folks would like to make before a vote is held?
Yes, I have a few questions about the bylaws. I know we have Appendix A with the potential removals, and I know we created criteria for nominations. Was there a reason why we didn't include the criteria for nominations into the bylaws?
Well, the criteria for nominations is currently, as we've talked about in the governance meetings, is currently an internal document. And in conversations with Claire Sappa, she certainly has an interest in working with us on clarifying what that document means. I don't know that it's ready to put into the bylaws at this point. Because as she is still learning part of her role and trying to interact with so many boards where things are seemingly done differently in many different places. I think there is maybe less clarity around that piece. But that's certainly something that, again, governance can add to its parking lot, talk about, and then, if needed, make a recommendation to the full board.
Gotcha. And has Clara seen this Appendix A?
I don't know. I don't think so.
Okay. I have a few questions about the Appendix A too. Under number 2, it says established processes. What are our established processes for those outlined potential causes?
I think those can be established, or the board can seek clarity from the city councilor's office. Chris, I'm gonna butt in for just a moment. I don't think that every single eventuality or possibility needs to be noted in the bylaws. I think what is important is that there is a process for figuring that out.
Thank
But
you.
I am only, yes, I am only
Yeah.
one member of the board, so
Yeah, definitely. I was just
yeah.
kind of concerned about that because I was like, we're putting this out there to the public and, just kind of just vetting everything that we're putting out there because it's a very thorough document, so just that's the question I just had specifically within the Appendix A, but everything else looks pretty reasonable as far as a potential removal, even though we don't have the power to do so, but I get that we have a recommendation power. So yeah, that's totally fine. I do have a recommendation for other duties, the duty sections for members. I was wondering if we can possibly, what's a suggestion under number 5 to put in like a language that says refer to purpose or something to include our advisory role. Um, yeah, for just that section specifically.
The number that says act at all times in good faith in the best interests of the city, the board, and the furtherance of the purpose.
Yes.
I'm sorry, what was the language that you recommend
To put
we amend?
referencing to section 1 for purpose.
Hmm. What do other members of the board think about that? It is purpose with a capital P, so perhaps
I
it
don't
will tell people to go back to the
This is
top of the
governor's
document.
language.
I don't
Governor.
particularly have a comment around. I think the document was well written, and I appreciate the effort that the governance committee has put into updating bylaws because historically I know a lot of boards that actually doesn't happen. My comment wanted to weigh more in on the purpose of Appendix A. I think that when you are a community advocate and you operate as an individual, I touch a lot of different spaces, so I'll use myself as an example. But I have to show up as Kristen in those spaces unless I have been appointed or recommended by the board to represent the board in my other affairs. And I think Appendix A helps us clarify how we show up as our individual professional selves and how we show up on behalf of the board and the separation between the two so that there is no conflict alongside of a lot of our jobs that have a lot of intersectionality in the work. Like when I train, I do not train as a vice chair of a board. I train as Kristen Simpson, the nurse practitioner, right? So in those spaces, I think that for me, my understanding of Appendix A is to clarify that we are operating in good faith. And I think in knowing that that is the clause, that every intent that you make on behalf of the board is in good faith of the board, and that you are leaning on your other fellow board members for comment, input, especially your leadership for guidance, if you have questions. And so it's a learning curve, I think, for many of us who are new to board leadership, new to board membership. But I do think it is important, especially in the season that we've been in lately, with our region and all the advocacy efforts and all the sensitive touch points, all the sensitive conversations, all the federal impacts. It's important to clarify when we're showing up as ourselves and when we're showing up as the board. That's just a comment that I would make on behalf of Appendix A. I do not have a fight, maybe fight's not the right word. I do not have a concern with adding additional context around understanding the board purpose. I feel like those discussions probably should happen with onboarding if there is clarity that is needed. But that is, again, I am one board member and I would love to hear how other folks have digested that. And I'm willing to explore if everyone wants to do what Dr. Daly has suggested. I am totally open doing what is in favor in the best interest of all of us.
Thank you. I think I saw Liz. Did I see your hand raised?
I would agree with that, Kristen, and I think the value in having that Appendix A is really honestly back to that onboarding portion. I think back when I started, and I know that having this clarity would actually help me at that point. So I do think having it in there is immensely helpful in knowing how we show up in different spaces.
Just to clarify, are we talking about the board purpose or are we talking about specifically Appendix A, the potential causes for removal?
My comment was specifically about Appendix A, and I know you had mentioned it being a public document and some concerns about like the language, maybe not the language, but I was just commenting on, I think, in that it helps structure and clarify our roles and how we show up in this space and how we show up in our professional spaces.
I'm trying to
Or
clarify.
Chris, can you
I'm trying
clarify
to.
what the concern around purpose is?
Well, I think we're confusing the two. Appendix A is for the potential causes for removal. I know the last comment I made was about the board purpose and including like governance language that says, hey, under our member duties, this is separate from the potential causes for removal. Under number 5, under members, it says acted in all good faith, in all times in good faith in the best interest of the city, the board, and the furtherance of the purpose. I'm suggesting that we add in that sentence the purpose that we're talking about is the purpose in section 1, which includes the purpose. So I'm just talking about governance language to specify and cite where we're pulling information from. So I know comments was made about the appendix, about like separating our roles of like our hats that we wear in different spaces with Appendix A. I just wanted to clarify with those comments that were made. Are we talking about the purpose or are we talking about the potential causes for removal?
Thank you, Chris, for clarifying that.
Yes.
My comments were on that Appendix A. I am wondering, though, to your point, with ensuring people know what section is referred to, would it be helpful to have something maybe after that purpose that in parentheses says, 1 point and then purpose?
Mm.
Yes. Yes. So refer to section 1 purpose.
Okay, that makes sense.
Okay. I actually just assumed that's what it was referring to since it was capitalized, but maybe we shouldn't assume. And just for full transparency and clarity, we could add that. But it just for the record, that was my assumption.
I had a similar assumption as well, but I don't know that I have too strong of an opinion one way or the other.
I echo Liz. I think whatever the group decides is best in terms of clarity, I strongly follow. And thank you, Chris, for clarifying.
I agree with everybody else. To me, it was implied that that's what we were referring to, but also no
Like this is going to
strong
be a
feelings either way.
public document, that's going out, people can assume all different ways and forms. So just to specify a little bit more, that's just all I had with that. I did have a question about under meetings. And when it comes to the agenda, can we explain the agenda creation process and what's known and understood from that point?
I'm not sure I follow exactly what you're asking.
So it says down under meetings, it says the chair shall send an agenda. I had a question about the agenda process, like how does that look like as far as like the creation of the agenda, what's being put into the agenda, how it's getting sent to the board members for their input, or if their input is actually inputted for it, or we just get the agenda and just but that entire process of that.
Well, the drafting of that is a duty of the board chair with help from the vice chair. Currently, the way this process works is that Kristen and I look very closely at what topics either have been hot topics, are trending topics, emerging issues, and paying attention to what is happening or being said in meetings, because often there's some follow-up that seems to be needed based on certain topics that come up. So we are really working to ensure that we're meeting both the knowledge needs of the board as well as inform the board about things that are happening in terms of public health work in our city and our region. That process may vary from chair to chair. I don't think it needs to be noted that there should be a specific process followed, because I do think it depends on who is sitting in that seat at the time.
I agree. I don't think it's something that should be outlined. And even if we have a process, it should not be something that's included as part of the bylaws.
I would agree. I would want the president and just the environment of public health to be able to then inform the details of how that works.
I would agree with both those comments.
And just to add, we work very closely with the department leadership to, inform the agenda. I may invite Craig to say a little bit about the 24-hour commitment we have to post it publicly. And so our charge has been to try to get it to board members, at least a week in advance, sometime depending on what's happening. That's not always possible, but that is the opportunity to add input, review, because we do have a timeline of the 24 hours, making any changes before it's publicly posted for community members to view. Do I have that correct, Craig?
Yeah, the sunshine laws require 24-hour notice to the public, so your agenda is already in place when you come to the meeting.
So in terms of, I think what I was, and you can correct me if I'm wrong, what I think I'm hearing you saying, where like, is there an opportunity for board members to have input on creation of agenda? And if I'm not right about that, you can let me know. But I think when it's sent out and that's an opportunity before it is posted to the public to say, hey, or if you have an idea beforehand, as we're in the midst of creating it, can send an email and kind of ask if things can be added to the agenda. And based off whatever the priority needs from board leadership and the department leadership, where those priorities sit, doesn't mean that it will be at the next meeting, but could be a future agenda topic. And it's historically, I think that has worked really well. It's probably, I'm looking around, I feel like me, Colleen, and Dr. Tapey have been the oldest members of this board and how it's functioned. And so that we're just kind of continuing that alignment with that.
Thank you. That clarifies my question.
Okay.
And I wasn't suggesting that we add a process to the bylaws. I just had a question about what that process was.
Okay.
Makes sense. Good question.
Thank you. All right, folks, is there additional commentary or questions, or can we move to a vote? Oh, I do want to back up for just a moment. Chris, I certainly heard your point about adding clarity to to number 5 in the members section, so that we don't run the risk of running overtime in this meeting. I actually think that this is a point that governance could bring back. This is another one of the parking lot elements that can be adjudicated in committee session at a future date. But it sounds like, from what I am hearing, majority of members that are present are ready to move forward with a vote.
Yep, that's fine.
All right. All right, well, thank you all for engaging, making sure that we are all clear on what this document's purpose is and what it does for us as a board. So I'm going to, so the motion was moved and seconded. And so now I'm going to ask for a vote on the motion to approve the revised bylaws, including Appendix A as presented. If the motion passes, the revised bylaws will take effect immediately. If the motion does not pass, the existing bylaws will remain in effect. I'm going to do a voice vote at this time. All in favor of the motion, please say aye.
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 Anyone opposed, please say nay.
Nay.
If anyone abstains, please indicate so. The ayes have it, and so the motion passes. So these bylaws will take effect, let's say immediately after this meeting. And I will, thank you to everyone who has offered their blood, sweat, and tears into this process. This is not my first time reviewing bylaws, but this was a very committed group of folks who spent many hours looking at them. And I'm just excited that we are now maybe starting fresh with some additional clarity. Because we have approved these bylaws, as I noted earlier, that does push up the timeline for electing a new chair and vice chair. I'm actually going to reach out to the governance committee immediately after this because there is a process noted in the bylaws, and I want to get some feedback actually on making that process smoother, perhaps with electronic forms that we can use so that we don't have to carry out every piece of um, the nominations process in person, since we only meet once a month, with the goal of having the election at our next meeting. So, if you all will extend me some grace, I'm going to move us along to our next agenda item. Thank you. Is there, Kristen, an update on advocacy?
Conflicted. Yes, we should always be advocating. So that's my confliction. But in terms of a formal advocacy, I think we've done quite a few opportunities. There have been some representatives from our board that have shown up to public comments. I know Brittany did one, I did one. We have sent a collective letter. That letter has also been sent to Board of Aldermen, who has noted that they have received it. And so I think there's maybe 5 or 6 advocacy touch points that we've been a part of and participated in. I know that oftentimes, and I shout out to Craig, who is always keeping me up to date on when public comment happens. Sometimes we find out 48 hours before, and I know that's really tough for folks to adjust their calendars. And so I do think that is something we can explore as we enter into this new season around where our focus will be. Currently, I think in terms of the funding discussion, I think there are just greater priorities in terms of what community needs, tornado recovery, SNAP benefits, WIC, things of that nature, that I think those advocacy groups are taking precedence in that space. But that, I don't know of any upcoming opportunities at the moment. But as always, as soon as I learn them, I will share them with the board as I have. And that's all I have.
Thank you. And you've already addressed the quarterly joint meetings. So at this time, I'd love to turn it over to the Department of Health, and I will let Commissioner Worry lead this section.
Good evening, everyone.
Hello.
So we just have a few updates from the Department of Health. When we were developing the agenda, Kristen and April wanted to kind of know of what we were doing top of hand for the SNAP crisis and due to the government shutdown. And so what we've been doing is really just elevating the work of the community to get the information out to individuals and to our partners around resources for SNAP and sharing information widely. There was an uptick in our social media around this topic. And then we also have developed resource lists of SNAP resources that we've been elevating with our partners. Do you want me to go to the next agenda item?
Yes, please.
Okay, great. So we have, so we're entering into respiratory season. I think this month was the first, well, no, actually it's in October. And so we're kind of in the middle of it now toward the holidays. And so I've asked David Courtney, one of our epidemiologists, to come and present his weekly influenza reporting. So David, over to you.
Hi.
I believe you can share screen.
Yeah, I will jump right on that. Thank you, Commissioner, so much for introducing me. And hello to the board. Thank you for having me. I am going to share my screen right now.
They're pretty good. They're pretty solid.
One moment here.
The lady fire supervisor She's a nurse practitioner.
Actually, it's on.
Green nurse and helping with the just seeing opposition.
All right. Can you all see the appropriate slideshow? I get a thumbs up from Kristen. Thank you so much.
Thank you.
Thank you. Thank you. All right. So as Commissioner Anwari said, we have entered into respiratory season 2025-2026. My name is David Courtney. I am an epidemiologist here at the City of St. Louis Department of Health. And with the help of our senior epidemiologist, Matt Haslam, we have prepared a brief update regarding the conditions that we see during the season. So kind of starting with the big picture, we'll be focusing on the main three currently discussed within respiratory season. So COVID-19, flu, and RSV. And at the moment, all three are low. Taking a more granular look at the City of St. Louis Department of Health and what's going on in the city, especially in terms of emergency department visits. The percentage related to influenza-like illness has been low and relatively stable since week 40, which we consider the beginning of respiratory season. Last week, the average daily percentage was 0.855%, which again is a low percentage. But I do want to highlight that it is a slight increase from the previous 2 weeks. And I do anticipate that number increasing within the next couple of months. So of course, for comparison's sake, I have presented a graph here with the previous 5 years in comparison to this year. As you can see with the green line, it's relatively similar to what has been present in the previous seasons. But of course, looking in the next coming weeks, we kind of see the upward trajectory. So again, I expect that the percentage of ILI visits will increase. Again, looking more specifically at influenza itself, case rates within the city have been very low. As typical, we're seeing mostly influenza A. And so far, a lot of the cases this season have been adults, and more specifically over the age of 40. And again, kind of for comparison, I have shown the previous 5 years. And obviously last year, it was labeled as high severity. And you can kind of see that with the light blue line and the swift peak, you know, at the beginning of 2025. And hopefully, you know, we won't see the severity, but as I'm sure you've seen in recent news articles and other published features, there has been a new subclade of influenza H3N2 identified. And it is a mutation, and it did occur recently. So it occurred after the vaccine had been put together. That may evade immunity. So, you know, we're a little worried that maybe that might increase numbers as well this season. So again, as always, we're encouraging the vaccination just to make sure that it's hitting all the other circulating strains. And for RSV, unfortunately, RSV is not a reportable condition, but there are, you know, ways we can kind of check and see the surveillance. CDC has a really great site, and as it kind of shows on the map in this corner, relatively, the numbers are low and the percentage of positive tests is low. And for Missouri, it is one of the lowest. And then as kind of a snapshot too, again, we don't really receive data regarding RSV, but St. Louis Children's has a great weekly pathogen report, and it kind of shows the number of positive tests related to RSV. And again, as you see the purple line down there, it is very low as well. And now to speak to COVID-19, again, rates have been very low, especially in considering the historical context of everything. At the graph on the far left, it kind of shows from 2020 to current. And you can see like much higher peaks, closer to 2020, 2021, and 2022. And then with the little snapshot right here, it shows that it is lower. We have had certain small waves, and there was a small wave this summer. Typically, there's usually about a 2 to 3 month break between waves. So, we'll probably see another wave coming this winter. And of course, testing unfortunately has dropped in recent years. And so it can kind of underestimate the true transmission. So that is why we also look at wastewater and hospitalizations. And so on the left, we have the wastewater surveillance for the St. Louis region. And again, that has actually been very low as well. And the data goes through the end of October. And kind of confirming that as well, we have hospitalizations in Missouri due to the three conditions we're looking at: COVID-19, flu, and RSV. And as you can see towards the tail end, again, the numbers are low, more caused by COVID currently, but that could change within the next couple of months. And again, just to kind of give a view of vaccinations, again, the health department actively encourages vaccinations. Unfortunately, I think vaccination rates have been kind of dropping over the past couple of years. A decent number of people are still getting the flu vaccine, it looks like, especially with those over the age of 65. And we've also included some maps of the zip codes within the area and vaccination rates. And basically, you can kind of see that the numbers are higher in the Southwest region, and more encouragement may be needed in the northern part of the city. And of course, I'll just end with some prevention methods. Going into holiday season, in the winter, there's a lot of risk for spreading the disease. So as I'll keep saying, we encourage you to get your seasonal vaccines. If you're traveling, especially within the coming week, we encourage you all to wear a mask, especially if you become symptomatic or if you'll be around sick individuals. Wash your hands, cover your coughs and sneezes. If you can, when you're hosting gatherings, try to ventilate the space. And of course, if you are sick, please stay home so as to not spread the disease. And really, that is it for me. So again, I just want to thank you for the time and for allowing me to present at this meeting. And I hope everyone has a healthy and safe holiday season.
Thank you so much.
So I just also want to remind everyone on this call that through the ARPA money that we received from the feds, there is a program where we have provided funding to the Integrated Health Network, which is a pass-through for the FQHCs for allowing free combination COVID, flu, and RSV testing, vaccination, and treatment. So anyone can go to the FQHCs to receive free testing, vaccination, and treatment. If people get vaccinated through, again, the combo vaccine of RSV, flu, and COVID, there's a $100 gift card that is provided and administered through the program. Just want to remind folks of that. I'm going to move on to some of our winter and tornado recovery efforts, unless there's any questions for David.
Yes, Commissioner, this is Nebu. David, thank you for your presentation and love seeing you on the Epi Minute stuff. So kudos to the health department for doing all that. I just had a question about your surveillance report. This stuff is regional. Have you all been in touch with the county or St. Charles? Are they seeing similar rates of respiratory illness?
Yeah, so I have specifically received reports from the county regarding their flu season, and they are seeing relatively low numbers as well. So yeah, it is in correspondence. They, of course, have a much more a wider region. So they have slightly more cases, of course, but in comparison to what the numbers they usually have, it is very low as well.
And I would just want to clarify one thing I said. So sorry, the combination for vaccination is for COVID, RSV, and flu. The treatment and the testing is only for COVID. Let's move on. So as you all know, we had a tornado on in May, and it affected over 100,000, I'm sorry, over 10,000 individuals and families. And, you know, most of the population that was affected in Cross North City is low income and already had severe unmet needs related to health, social services, behavioral health, physical health. And so the recovery is going to take a while. As part of the mayor's response, the mayor's office developed a recovery office led by the mayor's staff that is a coordinating body for the city's response to the tornado. And I am on one of the task force teams that's led by Dr. Adam Pearson through the Department of Human Services, and I'm the deputy under him for the Resident Wellbeing Task Force. This task force is responsible for supporting resident recovery and support systems, in making sure that the community has access to on-the-ground behavioral health supports, connection to physical health supports, and also, you know, our continued mission around making sure that public knows where they can get access to healthcare. The task force is also responsible for supporting families with children in the response to the tornado, and then also responsible for monitoring and addressing environmental health concerns related to cleanup and demolition. And so I just wanted to give folks a little bit of an update. So in addition to this, the mayor's office is making priority winter preparation this winter because there are the additional aspects of people unhoused because of the tornado. So we've been working closely with that response and this task force on shoring up a few winter resources. And so that will include additional utility assistance using some of the AMS interest money. We are making sure we promote information about daytime warming centers, as well as making sure that we are supportive of the city's overall response to winter. Shantae's team has developed the Winter in the City brochure. We are standing up with the support of the mayor's office, the mayor's office is standing up a hub for community information about winter resources. And then led by Dr. Adam Pearson from the Department of Health and Human Services, his group is leading the effort around homelessness and making sure that there are shelters operating in the region, that there's surge capacity during the colder months. And then we are just supporting his work in terms of, you know, helping out where we can plug in. The other piece that we are working on is air quality monitoring during upcoming emergency demolitions. So these are houses that are, we know who the owner is and they want to demo voluntarily. And so the city will be contracting with demolition companies, but our role as the health department is to make sure that we have we are monitoring the air quality around those demos, and all of the demo sites, per their contracts, have some specific requirements around mitigation of debris and cleanup. So our role is really monitoring that. And then the other big role that we have is we've partnered, so state FEMA has funded an initial crisis counseling program that is run through the Department of Mental Health state level. This program is It's called Show Me Hope. They're in training right now, and it'll be hitting the ground really next week. There are 8 providers, behavioral health providers, in the city, which includes that are part of this program formally. It includes People's Health Center, Places for People, Queen of Peace, BJC Behavioral Health, our Behavioral Health Bureau, the city, Freedom Community Center, Howard Institute, and Restorative Justice Movement. These folks are going to, the model of this program is on the ground, door to door engagement with community members around behavioral crisis counseling related to the tornado response. The program assesses the emotional needs of survivors, makes referrals to traditional behavioral health care when necessary, identifies linkage to community resource needs and disaster relief services, provides emotional support, basic crisis counseling, and they work in partnership with the local on the ground, local disaster organizations. So we're really excited to be a part of this program. And it's again called Show Me Hope. Counselors will be on the ground canvassing in the community, we believe as soon as next week. And there will be media coverage developed by the state with this program information so that residents know what it is. But the goal is really to work in partnership with those groups that have been on the ground since the day one of recovery, so that there's a trusted, there's the reception to the program is wider because it's coming from a trusted messenger. Over to Kristen and April.
Thank you so much. I put a link for Show Me Hope in the chat because I am excited. The program is a really excellent one, and I'm really excited that your staff are a part of this effort. We are running very close to time. So before we close this meeting, I was hoping to come to this meeting with answers to a couple key follow-up questions that folks asked us to share with Mayor Spencer. Those questions were centered around the search for the next leader of the Department of Health, and where we can perhaps find a job description, and exactly what competencies and skills the mayor's office is seeking. Haven't gotten that yet, and so hopefully that will be soon though. And if we get that prior to the next meeting, then I will just forward it out to the board. The announcements are that one, we have an in-person meeting in December. Do we know yet the location, or is that TBD? Kristen.
Yes, we're working with the executive assistants of the department to secure a conference room at the department's office. So more details to come. They have confirmed that we will share space. So on our normally scheduled December 18th, if I'm saying that correctly, is the 18th. I don't have my calendar up. Board meeting that will be in person. We usually try to at least do one at the end of the year to be in person, to share space with each other, to connect with each other. I think it's just really critically important. And to get to introduce to department staff and really get to know the work that they do, and do a tour is a part of it after the meeting if you have time and capacity to go around the department and get to learn their work and get to meet the great team there. Before I extend, I know that there was a small piece about lead update, and I didn't know if we could reserve a little bit of time for Bobby to talk about that, if that's okay with you, April.
I think I might need to ask Bobby, how much time, since we have 4 minutes left, or would it be better for you to present next month?
April, doesn't this meeting end at 10 a.m.?
This meeting ends at 9:30, correct?
No, the calendar says 10 a.m. Am I incorrect?
Yeah, these meetings last 90 minutes.
Mine is on for 10 as well. Probably just need
Is it?
a. Mhm.
Did I is my calendar not correct? One moment. No, I only have till 9:30. Kristen, are our
Oh,
meetings 2 hours?
historically, it's 9:30. I'm not, we can probably clarify that on the back end. I have a very old lake from when I started and I just transferred that over to this one. So we can work with the comms team. Bobby, how much time would you need to give your update?
I can get through it in 5 minutes.
Okay. Thanks.
I am open to hearing that as you so graciously have given your time and would love to hear your update if the rest of the board feels okay with reserving a couple of extra minutes to hear from Bobby.
Thank you. So Bobby, this context for the rest of the board is when the mayor's office came to the presentation, there were some questions around there was a statement about the lead program, and Bobby, I just wanted Bobby to come on and explain how the program works and our collaboration with the building division.
All right, thank you. So let me share my screen real quick and I'll get through this as fast as possible. Okay, I'm just going to present in this mode for the sake of time. Can everybody see the slides? Okay, so my name is Bobby Williams. I'm the Bureau Chief of Family Community School Health. This is just a quick refresher about our Let's Safe St. Louis program. Nurse Yvonne Franklin is our nurse that administers the program. We have this program because we have a lot of older infrastructure within our city, which most of us already know that, and we have a high risk for lead poisoning in our city. We conduct lead screenings. We have up to this point conducted 36 in-house here at the Department of Health, but regionally there have been over 6,000 lead screenings conducted. Our purview is 6 months to 6 years of age. We care about those babies. We'll go into further detail of why that's the case, but that's our area, our age gap, our age range of focus. But we do, our nurse Yvonne does a really good job of encouraging parents and guardians to get their children into their primary care physicians. So that's why we have such a low number that we do in-house versus what's done in totality for our region. We provide lead case management services. Nurse Yvonne has case managed over 717 children, again, from 6 months to 6 years of age this year alone. She provides supplemental services or case management services for those children that do not have them available through their own private insurance. We offer prevention consultations and presentations in the community. We have recently created an MOU with SLPS where we have gained inroads into their schools, and our reach has gotten a lot longer and strengthened in the community than what it has been in the past. And then we do also provide lead mailers and notifications as well from test results and from other screenings that we do with our partners in the community. There's just a little bit here, this slide about the lead history. Does everyone know that the state of Missouri is is the leading developer of lead in the nation? We actually have 5 lead mines that help to contribute to that. So what are the sources of lead right here? I'm not going to insult your intelligence by reading these, but these are the common sources of lead. Recently the Department of Health, we're very proud of the fact we did a huge study with the county and with our school system. And that's, if you recall, we got those new lovely water fountains in our schools to help prevent from lead contaminants in the water. So that's something else that we're very proud of. Of course, the reason why, again, we focus on 6 months to 6 years of age is because of the health effects. We know that lead mimics essential minerals that our babies need for their development. We're talking about cognitive, we're talking about behavior, we're talking about chemical, we're talking about physical. Lead likes to mimic essential minerals like calcium, like zinc. And if we catch that between that 6 month and 6 years of age range, then we're actually able to do corrective action and prevent lifelong damages from occurring within our babies. Here's a little bit more about the neurological effects that lead can impact that it can have on our babies. So we have a lot of strategic partnerships. The mayor in our last Board of Health meeting, she mentioned the building division. Yeah, and I know she said she wanted us to get a better relation or a close relationship. We do have a very close relationship with the building division. Nurse Yvonne, she is on a first name basis with everybody over there. I am too with the building division. We talk regularly. Matter of fact, this year alone, we're up to 104 referrals of children being referred in their environment to the building division. So they go out, they perform the inspections, and they perform lead remediation if needed within the homes. We also do inspect sometimes other environments, depending on the situation. We'll expect the schools when needed, or playground areas as well. Historically, I know we've done that as well. So here's a few takeaways. We know that lead exposure, it can be very damaging. We focus on 6 months, 6 years of age, and we have free testing available here at the City of St. Louis Department of Health. And this is the number that we advertise to the public. This is Nurse Yvonne's contact info, 314-657-1515. We like appointments to be made, because our nurse Yvonne, she's like a sweet grandmother. There's only one of her though, so we don't want to overwhelm her. So we ask people to make appointments and not just show up, so we can ensure that they are seen when they do come. They're not wasting a trip down here for no reason. Are there any questions or comments? I can address them now.
Baby Bobby, let me say that you did that in record time. It was so efficient, and I learned something. So, what are the kids?
Hey.
Clock that T, because you did that.
Well, I owe the commissioner, because the last time she let me talk, I went overboard.
I can see how you've evolved. So that was
Bobby's
that was
thorough.
great. That's all I wanted to
Thorough.
say. This was
Thank you.
really helpful.
Yes, ma'am.
Yes. Now, I have a question about where we can find these slides, or I don't know if there's a part of the website that we can direct folks to where they can read about what you just covered here.
Yeah, so I can work with Shantae to make sure it's up there. We do have some information already on the website underneath Family Community School Health. There's a subsection that Shantae and her team already created that's for lead, but we can update and make sure that the slides on there too.
Awesome. That was great. I certainly learned something new. So
do-
thank you for your work. I'm sorry, someone about to speak.
I actually have a question. Is there any discussion around, like, I know Commissioner Nwari talked about demolition occurring in certain areas and zones. Do you anticipate needing to increase lead accessibility or awareness around those demo sites, or knowing that the infrastructure, some of the oldest infrastructure in the city, is now damaged? Has there been any discussion around supports for that?
Yeah, so that's actually that's very astute observation. So it's from what is it? I forgot what was the acronym we were using, Commissioner? I can't remember, for the centers over at on SLU's campus. I forgot where we were handing out information. We were providing lead poisoning safety information there, and also the lead remediation information there as well. And we'll continue to do that throughout this whole process. I'm still working with one of my colleagues, Rhonda Bartow, with my mind just went blank. Commissioner just said his name. Dr. Oh my goodness. Commissioner, what is the doctor's name?
Which one?
Who we're working with for all of the tornado relief response.
From
Here-
DHS?
I'm sorry.
Pearson.
Yes, thank you, Dr. Pearson. Yes. So we're still working with Dr. Pearson, and so we'll continue to make sure we channel all of that educational information where it's needed. But yes, thank you. That's a good comment.
Thank you so much. Folks, I did check, and this meeting generally does end at 9:30. So I was like, am I losing it? I am very glad though that we took the time to make sure that we heard more about the work that your team is leading around lead. So thank you again, Bobby, for being here and for sharing that and for hanging in a few minutes extra. Before we leave, as we have passed bylaws and we will be electing a new chair and vice chair, the governance committee wants to make sure that you all know that nominations are open. Nebu, would you like to chime in prior to us ending this meeting?
Yeah, so nominations are open. Please send them to anyone on the governance committee, which is me, Chris, April,
Colleen, Liz. Yeah. And there will be
and
a form too that we'll send out just to make it easier. But
self nominations are okay, right?
yes, you can nominate yourself. You can nominate others on the board. You can look at section 2 on officers for more info about exactly what the roles are for chair and vice chair, if you're wondering. But I certainly look forward to seeing who wants to step into leadership as a chair or a vice chair next. And look forward to seeing as many of you as I can in person at the December 18th meeting. So thank you again for all the work that everyone has been doing. This is just a stellar team that works to advance public health and human thriving in the city, and the board thanks you all. All right, well, have a happy Thanksgiving, a COVID-free one, as Colleen said, and look forward to chatting with you all again next month.